12 bad habits that damage your kidneys. Hi, it's Dr. Derek here. I'm going to ask you a question, which may sound personal, but do you ever stop to think about how your lifestyle may be affecting your kidneys? Because the chances are that you may have some habits that are harmful to your kidneys. And this is supported by the data which shows that over 7.2 million people in the UK suffer from kidney disease. This is more than 10% of the population. Because of how significant this condition can become, it's so important that we do everything we can to avoid damaging our kidneys. So here are 12 of these bad habits that you need to avoid. Starting at number 12 is eating foods that are high in sugar. Studies such as this meta-analysis show a statistically significant increased risk of chronic kidney disease in people that regularly consume foods that are high in sugar, such as sugar-sweetened soda. High sugar diets also increase the risk of conditions such as diabetes. These high levels of blood sugar can damage the blood vessels in the kidneys, which means that they don't work as well, leading to damage to kidneys over time. Number 11 on our list is a poorly treated blood pressure, which also, just like diets high in sugar, can eventually damage the kidney blood vessels, reducing its function over time. So it's really important that if you do have high blood pressure, you keep an eye on this. Take your medications and make sure that you see your doctor if you are concerned. You can also check out my blood pressure video here for more tips. Number 10 on our list is a high sodium intake in your diet. Now, the reason why this affects the kidneys is simple. If we eat too much sodium, water is pulled back into our bloodstream. The more water in our blood vessels, the higher our blood pressure gets. And like we talked about before, high or uncontrolled blood pressure will increase the risk of kidney damage. This is why it's so important to have everything in moderation and avoid excess. Consider using herbs and spices to flavor your food, and be mindful of salt content. Number 9 on our list is something that has resulted from a change in our societies, where we are a lot less active in our day jobs than what was common during the past years. This is a lack of physical activity, as well as increasing the risk of conditions such as diabetes and obesity. A lack of physical activity also significantly reduces the efficiency of the cardiovascular system and blood flow through to our kidneys. It is known that greater physical activity is associated with improved blood pressure and glucose metabolism. These are both important factors in kidney health. Number 8 on our list is overusing painkillers, such as our non-steroidal anti-inflammatory drugs. These are a common cause of kidney damage. Examples of these medications include drugs like ibuprofen and naproxen, which are commonly used for pain relief in arthritis. Overuse of these medications can cause kidney damage by reducing blood flow to the kidneys. Now, prolonged or excessive use may lead to chronic kidney disease. Therefore, being aware of this should make you realize that it's really important to limit the use of these drugs. And if you do need pain relief, consider alternatives like paracetamol. Consult with a healthcare professional to manage your chronic pain. Number 7 on our list is smoking. Now, smoking is a major risk factor for kidney disease. A major meta-analysis study consisting of 15 prospective cohort studies showed evidence for cigarette smoking as an independent risk factor for chronic kidney disease. Smoking has this effect by damaging blood vessels, reducing blood flow to the kidneys, and promoting the formation of kidney-damaging substances. Therefore, if you are a smoker, it's so important to seek support from healthcare professionals, support groups, or smoking cessation programs to improve your chance of success. Make sure you also check out my stop smoking video here for more tips. Up next in number 6 is not hydrating yourself well enough, which over the long term can be a cause of kidney damage by impeding the ability to filter out toxins. Chronic dehydration can also contribute to kidney stones and other kidney problems, so ensure that you drink an adequate amount of water daily, typically around 8 glasses. You can also adjust how much you take based on factors such as climate, physical activity, and your individual needs. Up next in number 5 is not using the toilet when you feel the urge to. See, holding in urine regularly can lead to urinary tract infections and potential kidney damage by allowing bacteria to multiply in the urinary tract. So, Practice good bathroom habits to minimize the risk of urinary tract infections. Alcohol excess is up next in number 4. Now, heavy consumption can lead to kidney damage by impairing the kidney's ability to filter toxins and regulate fluid balance. So when it comes to alcohol, limit your intake and adhere to the recommended guidance. Men and women in the UK are advised to drink no more than 14 units of alcohol a week. If you have concerns about your alcohol consumption, make sure that you see a health professional for more help with this. Number 3 may surprise some of you. This is a poor sleep. See, evidence from a cohort study of more than 190,000 people suggests that a short sleep duration and poor sleep quality are associated with an increased risk of chronic kidney disease. Being aware of this is the first step for you to prioritize this area of your life and look into sleep hygiene resources. Make sure that you check out the video I created above for more tips on this. Next up in number 2 is eating processed foods. These often contain high levels of sodium, additives and preservatives. These contribute to high blood pressure and kidney strain. Making lifestyle changes is completely under your control. Choose fresh whole foods over processed alternatives. And also read the labels on the back of your foods to monitor sodium content and prioritize a balanced and nutritious diet. And last on our list is a diet heavy in excessive red meat. Studies such as this here show that a higher consumption of total red meat is associated with an increased risk of chronic kidney disease. Excess animal protein can generate high amounts of acid in the blood that can be harmful to the kidneys and cause acidosis. We know that protein is needed for growth and repair of the body, but it's important that your diet is a well-balanced one. You see, avoiding the progression of kidney disease by being aware of these bad habits is so important because damaged kidneys could also have an impact on the function of other body organs such as the liver, leading to a condition known as hepatorenal syndrome. In this condition, as the kidneys stop functioning, toxins begin to build up in the body, leading to liver failure. Make sure that you check out this video right here to learn a little bit more about how the function of these two organs are linked to each other. As always, if you found this video helpful today, please leave a like and subscribe. And remember, I truly care about your health and I wish you the very best.